in gynecology and obstetrics. So today's video I'll be discussing about the molar pregnancy. So viewers, beginning with, what is a molar pregnancy? So molar pregnancy is defined as a group of gestational trophoblastic disorders. So gestational trophoblastic disease, it is a kind of a during the period of pregnancy, that is during the period of gestation, there is some kind of a disease or an abnormality what is going to occur in the trophoblast cells, and it's a gestational trophoblastic disease in pregnancy which leads to the formation of small fluid filled clusters of fluid filled vesicles or sac-like structures that fill up partially or completely within the uterus. So, before getting into the details as to what is the trophoblast layer, we need to get to know what is the trophoblast layer, how is it formed, and what is its role, and how this molar pregnancy proceeds. So, actually, you must have heard that whenever during the process of fertilization, what happens is that once the ovulation has taken place, the ovum is being pulled up by the fimbriae. These fimbriae are there in the infundibulum, and the fallopian tubes, they have fimbriae, finger-like projections, and these finger-like projections, they are in constant rhythmic motion. They will pull up the ovum, and the ovum is slowly and gradually going to proceed into the fallopian tube. Now, at the most swollen portion of the fallopian tube, it is called as the ampulla, whereas the joining where the ampulla and the fallopian tubes are joining, that is called as the infundibulum. So the fertilization of the ovum with the sperm takes place in the ampullary isthmic junction, and from here the zygote slowly and gradually proceeds towards the uterus, and finally at the blastocyst stage it is going to get implanted into the uterine wall. Now this blastocyst, once it is formed, it is having an outer cell mass which is called as the trophoblast, and an inner cell mass which is actually going to form the embryo. So the outer cell mass which is the trophoblastic layer. So this trophoblastic layer, the word trophos itself means to feed. So actually the embryo which will be formed from the inner cell mass, that embryo is going to derive its nutrition and nourishment from the trophoblastic layer, which is the feeding layer. And ultimately, this trophoblastic layer will later, in the later stages of pregnancy, this trophoblast will finally get converted into the placenta, through which the embryo, the fetus, is going to get the nutrition and the nourishment. But in the condition of molar pregnancy, it is a gestational trophoblastic disorder. It means the trophoblastic cells are going to proliferate abnormally into various small size fluid filled balloons or sacs or vesicles, which are going to partially or completely fill up the uterine cavity. So actually, this gestational trophoblastic disease. It is in this condition of molar pregnancy, the fertilization of the ovum with the sperm goes wrong. And how it goes wrong? In a normal fertilization, what is going to happen is one set of haploid chromosomes in the sperm is going to get fused to the ovum, which is containing a haploid set of chromosome. The ovum is having a haploid set, the sperm is going to have a haploid set of chromosome X or X or Y. So X chromosome, it is always found in the ovum. So the ovum is having a genetic makeup of only X chromosome, whereas the sperm can be either of X or Y variety. Depending upon it, the haploid ovum and sperm, they are going to fuse together to form the zygote, which is again a diploid condition, which is again a diploid cell. So in the condition of molar pregnancy, the fertilization of the sperm with the ovum goes wrong. And how it goes wrong? So in this in condition of molar pregnancy, this fertilization can either happen where a sperm is going to fuse in an ovum which is devoid of a chromosomal material, which is lacking genetic material, which is lacking chromosomes. So an ovum can be an empty ovum without any genetic material, and in that case a sperm can come and fertilize it. Or there might be certain cases where an ovum with a genetic material might get fused to two sperms. So such a condition, this leads to molar pregnancy. And this molar pregnancy, when we talk of the incidence of this molar pregnancy, it is mostly seen that Asian women, they are having double the chances of having such a pregnancy than the non-Asian women. And this molar pregnancy is quite common if we observe the data, that out of 529 pregnancies in the United Kingdom, one will there is a chance that one can have a molar pregnancy. So beginning with, in this video we'll be mainly focusing on that how this is going to proceed. What is the molar pregnancy? I have already discussed, and the other name for it is also called as the hydatidiform mole. So this hydatidiform mole, since it is an abnormal cell mass, so this is actually a molar kind of a thing. It is a abnormal proliferation, abnormal number of cells are there. So actually this is also called as the hydatidiform mole, or a molar mass, or a molar pregnancy. So in the condition of a complete mole, so complete mole, the condition is going to arise when incomplete mole, what do we find is that the ovum, what has been in the fallopian tube, that is devoid of a genetic material, or it is lacking the chromosomal material in the ovum. So the ovum is devoid of genetic material, and once a sperm comes and fuses with such an empty ovum which is devoid of genetic material, so this fusion, once it is going to take place, so the sperm is a haploid set of chromosomes containing a haploid set of chromosome, fertilizes with an empty ovum. Now, once it enters the haploid set enter, it duplicates by itself. The condition, this auto duplication of this paternal chromosomes takes place. So again, it gives rise to a diploid condition, and this auto duplication of the the sperm, the paternal chromosomes of the chromosome, this duplication, it is also called as androgenesis. Why? Just because what is happening is that it's the male parent, or the chromosomes of the male parent is getting duplicated inside an empty ovum. So this duplication, it is auto duplicating by itself, and the condition is called as androgenesis. So in 90% of the cases of complete mole, this condition is happening. That is, it is a monospermic condition with a haploid set of chromosomes is going to fuse into the empty ovum. It is going to get auto duplicated, and once it is auto duplicated, what is going to happen is again the diploid set of the chromosomes will be restored, leading to giving rise to either this 46XX type of chromosomal diploid condition. Now, so very important thing, other case can so this is actually such a condition. So these cells are going to proliferate abundantly, enormously, and finally this is ultimately going to give rise to a grape-like swollen sacs, small vesicles which are fluid filled, watery. So these are grape-like vesicles which are constantly filled with such fluid, and they accumulate and they go and implant into the uterine wall. So this condition, it is this trophoblastic layer, it abnormally proliferates and it fills up the entire uterus, giving rise to a molar pregnancy. So actually, in the case of complete mole, there is no fetus. The chromosomal material, it is only coming from one of the parent, so that the chromosomal material is paternal in origin. The cells what are formed is diploid, and this is a more dangerous condition as compared to a partial mole. Now, there can be other instance as well, where an empty ovum can either get fertilized by two sperms, that is either XY or XX. So these two sperms are going to fertilize an empty ovum, giving rise to a diploid condition of 46XX and 46XY. So again, this diploid set of chromosomes will multiply enormously, filling up the entire uterine cavity, and this is with no fetal development. So actually, in a complete mole condition, there is no fetus present, and these grape-like vesicles are completely lying inside the entire chamber of the uterus. Now, once the sonography is done of such a case of a complete mole, it is going to show the appearance of a snowstorm appearance, as if there are radiolucent tiny droplets or tiny droplets or sac-like structures. They'll be completely visible in the entire sonography, and this condition is referred to as the snowstorm appearance. Next, now moving on, nowadays, actually in the first trimester of pregnancy only, these molar pregnancy is quite easily detected, and if this is not being detected in the first trimester, so later on it will give to a difference in list of symptoms. So initially, once the molar pregnancy is conceived, the symptoms what the expecting mother is going to face is that she can complain of in the first trimester only. Such a pregnant lady is going to complain of that there is some kind of a brownish discharge or a bright red discharge from the vagina. Apart from this, she can also complain of that she is passing some grape-like cysts or grape-like droplets or prune juice-like droplets are passing through this vagina, and she can complain of this. Apart from this, since this is a gestational trophoblastic disease, the trophoblast cells are enormously multiplying into vesicles, so the level of hCG is too much. So elevated levels of human chorionic gonadotropin hormone, which is responsible for the nausea and the vomiting of pregnancy. So in such expecting mothers, they will be more predisposed to nausea and vomiting just because of the enormously risen levels of human chorionic gonadotropin hormone. So there will be excess of hCG hormone. They will feel more nauseating and vomiting. Apart from this, they can complain of passage of certain grape-like structures through the vagina, and last, they can either complain of a pelvic pain or persistent pelvic pressure pain they can have. So this was about the complete mole. Moving on to the next type, that is the partial mole. Now this partial mole condition, it is actually a condition where a single ovum is getting fertilized by two sperms. So this being fertilized by two sperm, the condition is called as dispermic fertilization, and the sperms can be either of two varieties. This can be an X chromosome carrying sperm or a Y chromosome carrying sperm, or both the sperms can be XX or both the sperms can be XY. When they fuse to a single X chromosome of the ovum, the condition, the first cell what will be formed, it is the zygote is going to be a triploid condition. This will be a condition of triploid, and the chromosomal genetic makeup of such cells can be either of three varieties, that is 69XXY, 69XXX, and 69XYY. So out of the three, the most common variety is the 69XXY condition. So the partial mole, it is derived from both the parents. The condition is triploid, and since both the parents' chromosomal material is being involved, so in conditions of partial mole, the fetal-like tissue is present. Along with the molar tissue, fetal tissue is also present in the condition of partial mole. So fetal tissue is also present, and most of the molar pregnancies are diagnosed in the first trimester. But if they are not diagnosed in the first trimester and they move on to the later trimester, actually the fate of the molar pregnancy, unfortunately, is going to be a miscarriage. So if the pregnancy, if it is not diagnosed in the first trimester, the clinical features, what the expecting mothers, they can say that what they mostly complain of, that their uterus is growing more as compared to the gestational age. So a 3 months old pregnant lady might give the appearance of the fetus of the tummy size to be of relating to a 5 months or a 6 months old pregnancy. So their fetus, the enlarged uterus is, the uterus is abnormally enlarged. A uterus is growing quickly and being too large early in the pregnancy. Apart from this, if the condition of progresses from the first to the second trimester, a condition called as preeclampsia, which is the pregnancy induced hypertension, what is mostly seen in the gestational age of more than 20 weeks. But in conditions of molar pregnancy, this preeclampsia condition of such an expecting mother who is having a molar pregnancy, she might have a preeclampsia before 20 weeks of gestational age. So this preeclampsia condition is there, and as I've already said, that due to increased levels of human chorionic gonadotropin hormone, this has been excessively increased. So this human chorionic gonadotropin hormone is going to mimic, or it is going to resemble the thyroid stimulating hormone, and indirectly this sends signals to the thyroid gland to secrete abnormal quantities of thyroxine hormone, leading to the symptoms of hyperthyroidism in women who are affected with molar pregnancy. So the symptoms of hyperthyroidism, such as tachycardia, that is the increased heart rate, sweating, intolerance towards heat, blurry vision, headache, such blurring of vision, such symptoms can also be seen in such women. So actually, this is a condition of the partial mole. Now, when it comes to the treatment, so either it be the partial mole or the complete mole, both the treatments is ERPC, that is the evacuation of the retained products of conception. Both in both partial and complete mole, the evacuation is done. All the products what are formed during conception, they are being evacuated from the uterine cavity, and it is surgically managed. In some conditions, the treatment of line, the management can be through medicines and drugs as well. Apart from this, there can be certain instances where in cases of a complete mole, 15% of the chance cases are there which is going to have a recurrence. Why? Because some amount of the grape-like structures what are there, these grape-like structures, they might get embedded into the deeper tissues of the uterine wall, which can lead to further which can lead to into the deeper tissues. Once it gets embedded, it is called as the persistent trophoblastic disease. So once it persists in the uterine wall, there is a chance that this condition of molar pregnancy might recur in such females, might recur in such women. So this, once it evades, it gets embedded into the uterine wall, this is called as the invasive mole. And the treatment of an invasive mole, either in case of a partial mole or a complete mole, it is chemotherapy. The certain drugs will be patient will be administered, patient will be given certain medications and chemotherapy. So this the condition of this invasive mole can also be treated. So students and viewers, I have tried my level best to simplify the condition of molar pregnancy, how it is occurring, what are the two types of molar pregnancy, the partial mole and the complete mole, and what is the surgical management of it, how the diagnosis is there. Diagnosis is always through the ultrasonography. In the early first trimester, in most of the cases it is detected, and if it is not detected in the first trimester, later on the clinical symptoms will progress into a more aggressive one. So students and viewers, if you still have any queries or comments, and if you are new to my channel, if you like this video, give this video a thumbs up. And students and viewers who are new to my channel and haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.